is a production of West Virginia Public Broadcasting.
Major funding for Doctors on Call is provided by a grant from the Milan Charitable Foundation. Other funding is provided by the Health Plan, a health maintenance organization serving West Virginia and Ohio since 1979. By the Center for Organ Recovery and Education, supporting Volunteers for Life through organ, tissue, and corneal donation. By Health South Rehabilitation Hospital, serving your rehabilitation needs in Morgantown and Fairmont. And by the faculty and staff of the Robert C. Byrd Health Sciences Center of West Virginia University. Welcome to Doctors on Call. Tonight's topic, children's health. 3 experts are here to answer your questions. Now here's your host, Dr. Kathy Moffitt.
Good evening. The kids are going back to school soon, and you know what that means. They'll be coming home with all sorts of things. And we're not talking about homework. We're talking about germs. Some of the things we wish our children wouldn't share in school, like their colds and the flu and other more serious infections. Problems. So what can you do to keep your kids healthy? What are the latest treatment options for asthma? Does your child have a behavior problem that will affect his success in school? We'll get answers to these questions and more tonight from our 2 guests, Dr. Maggie Janes, a pediatric neurologist at WVU, and Dr. Sylvia Cardenas, a pediatric pulmonary specialist at WVU. And my specialty is pediatric infectious diseases. So all 3 of us can answer your questions tonight. If you'd like to ask a question, give us a call. Our phone lines are now open. So Maggie, I'm the mother of 2 boys, and they've had a good summer, and I want to keep them healthy, and we're looking towards school. What can we do to prepare them to get ready for school?
I think one of the most important things is get them back on a good sleep cycle. It's summertime, it's light outside, they stay up late. Now's the time to get them back on that time that they are supposed to go to sleep at night for school, and time to get up and to get ready for the bus in the morning.
Right. And Sylvia, we're all aware of what happened last year with H1N1. Do we have any predictions of what the flu season's going to be like for next year?
Well, we don't know much yet, but actually today we learned from CDC communication that there have been some isolated cases in the area, which even when we are in the middle of the summer, but this has happened before as well. And the good thing with this is that the strain that they suspect they have isolated is included in the upcoming seasonal flu shot.
Right. And so the seasonal flu shot usually contains 3, and we know that H1N1 from last year is in there, plus this one that's recently been isolated, the H3N2. And then, so kids had the flu shot last year. Should they get it again?
Well, yes, they should get every year the seasonal influenza shot.
Right, right. And the recommendation is all children now.
Every children, yes, should receive the immunization.
Right, and including healthcare workers and kids who take care of young children. So Maggie, bullying is a big topic with kids in school.
It is, and it's the kind of thing I think parents can help their child with. How to handle other children who may say things to them, how they should deal with it. There's a good website out there for parents. It's called stopbullyingnow.org, and it actually gives parents things that they can help their child with, little kind of scenarios to practice what happens if somebody would try to bully them. So there's some information out there that's helpful for parents, and it also has a piece for kids so they can actually practice and learn how to react to people who might bully them.
Right. So our phone lines are open. Please go ahead and give us a call if you have a question. So, a child won't come home and say, I'm being bullied, but being maybe taunted, maybe being left out of things. How would a parent know their kid is being bullied?
They might see a change in their behavior. They might see that they're more reluctant to go to school. So maybe before they were really excited about it, but now they're more reluctant to go. They may come up with kind of more physical ailments that are sort of non-specific. They have a stomach ache, they have a headache, they just don't feel right this morning and don't want to go to school.
Yeah, I know there was a little boy in our neighborhood who wouldn't get on the bus after having ridden the bus for half the year, and then it turned out there were kids older kids picking on him on the bus, and he was afraid to get on the bus. So sometimes those other things may be the clue that there's something going on.
Right.
Now, you see a lot of kids with asthma, Sylvia. How can the kids kind of take charge of their asthma in school, or what do you tell parents to get ready for the kid going to school who has asthma?
I think what we always tell parents, and when we are in the clinic during the visit, also we try to see with these kids that they are able to identify their own symptoms. Symptoms of asthma are not always the same for all the patients. Some of them could have cough. Some of them are able to identify that they are wheezing. Nocturnal cough or exercise-induced symptoms are also symptoms that some kids are able to identify and to tell. And I think parents also should be aware of these symptoms, which most of the time they are, and be prepared and let the nurses at the school also know about these symptoms.
And kids with asthma can take part in gym class. I mean, we want them to exercise, right?
Yes, and actually that's the main purpose of treating asthma. We want your child to have a normal life, be able to exercise and practice sports as every other child, and that's the purpose of the management of asthma, to manage the symptoms in a way that they are able to have a normal life.
Right. And so the parent isn't there. I know when my child had food allergies, I'm not there with him all the time. So you teach your child to recognize the things, to then maybe go to the nurse or go to the teacher and say, my chest is tight or I'm coughing.
And even if they are wrong, it's better to identify early their symptoms, and then we'll further decide if this was symptoms of asthma or not.
And a fair number of kids take medicine, have chronic disease and take medicine. So Maggie, what do you tell your parents about getting ready for school?
Well, one, if their child takes medication at school, it's really important to get in touch with the school before school starts. There are forms that you have to fill out to allow the school to be able to give medication. And if you've not had those forms signed, then the school isn't allowed to do it. So we always encourage families to get that signed. The other thing is, we really encourage our kids to know their medicines, know the names of their medicines, their doses, and to learn about their disease. And as Sylvia said about asthma, I think that's true about a lot of chronic diseases, for kids to be able to recognize when they're beginning to have symptoms.
Having problems. Right. We have a caller, Brenda, in Mercer County. Hi, Brenda. Go ahead. What's your question?
Hello. I have a 2-year-old granddaughter who's a biter. On occasion, when she gets frustrated, other children have her toy and she may try to get it. So how can I help her with this?
So a biter, a 2-year-old who's a biter and gets frustrated.
And it's oftentimes kids, they don't have a way to show that they're frustrated, and that's the way that she has found to be effective for her. But trying to redirect her as soon as she starts to do it, correct her. Also start to look for situations where it might be beginning, like she might look like she's going to do it, then sort of head her off of the path, redirect her
and help her with some of the skills, which is the language that children acquire in that year 2 to 3, so then they can say with their words, hey, that's mine. And when they're a little younger, they can't do that. Yeah, I remember when my younger one bit my older son once, and I luckily was right there and nabbed him and just moved him and said, no. And then I gave sympathy to my son who was bit, and the younger one was just frantic because he realized he'd done something wrong, and that was only one time, but I'll tell you, the older one thought for weeks afterwards he was going to get bit. So he jumped back, but we were able to nip it, but you're not always able to nip it. And so it
takes some time sometimes.
So I think it's anticipating maybe when those situations, you see him start to scuffle over a toy, get over there and help to separate, or get him something, divert them.
And give him the words. I think that's a very important thing.
So we have another call from Jeannie in Marshall County. Hi, Jeannie. What's your question?
Hi, I have a daughter who is 22 and in college. She, for years, got allergy shots for seasonal allergies. Right. She still suffers greatly from them, even after years of shots. Okay, so my real question is, my son now is about to turn 17. He has asthma and allergies, so he's even more at risk than she is. But the doctor and I are trying to talk him into getting these allergy shots, but when he sees his sister's experience with them, he doesn't really want to do that. So my question one is this the most beneficial therapy for allergies and asthma? And B, if it is, how can I get him to maybe motivated enough to want to start this?
I think that's a great question, Sylvia.
Yes, and I think prior to the point of getting immunotherapy, which is the name for these allergy shots, the management of asthma has prior steps that asthma is an inflammatory condition, and one of the main steps in this inflammatory condition is the use of anti-inflammatories. Inhaled steroids is the main thing we use. So I think probably I will need to know more about what treatments and your kid is so far receiving to see if this is the next step for him, if we are at that point, or there have been steps that still we are able to take before.
So really maximizing the medication there is to help dampen down kind of the response there.
Yes, and it will depend also the severity of the asthma. Asthma has several degrees of severity. Patients with mild asthma, they don't need maintenance therapy or daily medication.
Right.
And others with more moderate or more severe asthma will. So we'll need probably to know more about
So someone who's been in the ICU because of their asthma or needs frequent systemic steroids, or then those are the severe ones, whereas someone who has able to control it a little better may not be. So kind of balancing all those things. And it's tough. A 17-year-old really has say and choices. He's almost an adult, and so we need to include him and maybe educate him probably about asthma and what maybe potentially could happen, kind of understanding where he is with his disease. We see this in my clinic. The younger kids, we've educated the parents, and then we have teenagers, and maybe you too, Maggie, when they reach adolescence, it's kind of a second time to educate.
Right. A lot of children that I treat have epilepsy, and sometimes the adolescents will decide, well, I'm doing well and I can stop my medicine. And so it really is a time to educate them and educate them about the risks, but and to help them understand the disease and what the treatment actually does. And I think a lot of kids appreciate being included.
Well, and I wonder then if a big motivator is driving.
Oh, it is. It's a huge motivator.
So what is the rule about seizures and driving?
In West Virginia, it's been that it's been a year. You have to be seizure-free for a year, but I believe I just saw something within the last week that it may be 6 months now.
Okay.
But you have to be able to say that the person is responsible, and that's the piece that I always throw in with the kids. Yeah. If you don't take your medicine, then you're not responsible enough to drive.
Yeah, because you wouldn't want them to be behind the wheel and then have a seizure and lose control. So we have another caller from Pamela in Kanawha County. Hi, Pamela. Go ahead. What's your question?
Yes, my 2 grandchildren both got the swine flu shot last year, and they each got 1 dose.
Right.
And I was wondering, they're under 5. Is it too late still to get the second dose?
So that's a good question, and they don't need. Actually, all the H1N1 vaccine expired. I believe in June, which is usually when flu vaccines expire because we're waiting for the next year's vaccine. So now this coming seasonal flu vaccine actually has H1N1 in it. So we won't have 2 shots to offer this year. There will be 1 vaccine. And yes, they should receive it. So we know that children are the ones who carry flu and get sick from flu, the biggest, but they also, if you prevent flu in children, you prevent it in us and in the teachers and in their younger siblings and in their grandparents. So the answer is yes. I think they should get flu shot. And so the flu shot this year contains 3 as usually, but one of them is H1N1. So even those of us who had the H1N1 last year should get it again. And that's a mystery because we don't keep our protection or immunity. It fades, and that's why every year we should get a flu shot. We were talking a little earlier about school nurses and the forms. So often what I do, we'll start talking at the end of the year, of course we're already in summer, about getting those forms and being ready now. And there are many parents then who are prepared for that, because we don't like to get the end of next week, school starts on Monday and you have a pile of forms. So start thinking about it now.
Right, and I think the school nurses are great, and many counties send out the forms early or give it to the parents at the end of the year so that they can get them done over the summertime.
And I don't know if they're available online with the school, or probably giving a call to your school and can put them in contact, and the nurse then can get that, and probably could fax it to the parent or mail it or pick it up.
And many of us have our own forms that comply with the school regulations.
Yes, that's what I was going to say. In our case for asthma, we have our own form, and if they don't have a formal or official form, we could always fill one in the clinic for them to be ready before school starts. Yes.
Right. Now, one topic that we are aware of that we hear about in adults, but we're actually learning that kids get sleep apnea. So how is that? Do they all snore, or what is associated in children with sleep apnea?
Well, I think the main symptom that we have to be aware that may be related with obstructive sleep apnea is snoring. Parents that notice that their kids snore, they should be aware that this could be a manifestation of obstructive sleep apnea. And other symptoms that they may present are apneas or episodes of gasping for air while they are sleeping at night, or apneas will be a stop breathing for a few seconds at night. And some kids also could have a sleepiness during the day, but also they could present with hyperactivity, which is different from adults. Yes.
Right. So you may see them that they're having behavior problems or school problems, and it's actually sleep problems.
Right.
Yes.
Right.
Yes.
Is it more likely in children who are overweight?
Yes, it is. It is, and the same for adults. Overweight definitely plays a major role in obstructive sleep apnea.
And maybe tonsils.
In kids, probably the main difference between children and adults with obstructive sleep apnea is that obstructive sleep apnea in the majority of kids, and a great percentage, the problem will be resolved in most of the cases with removal of the tonsils and adenoids.
And so then if that's not the case, then sometimes you do use BiPAP or CPAP, which is the mask they wear at nighttime when they sleep.
Yes, we would have them assessed to see if they are candidates for having their tonsils and adenoids removed, and if they are not, then the next step would be to use a BiPAP or a CPAP.
And the way you do that is you actually do a sleep study where you have the child come and sleep in the sleep lab.
Yes, and a special day they come and sleep in a sleep lab. It doesn't involve any invasive procedure, no needles. They just have to come and have normal sleep in the regular schedule.
And can the parent come and stay over with that?
Yes, which is a good thing. Parents always are welcome, and actually we want them to come for the kid to feel more comfortable.
Wow,
yes.
Interesting. So we have a caller, Peggy in Wetzel County. Hi, Peggy. What's your question?
Okay. I have a grandchild that's going to go to college this year. The child is 18, and I was wondering, he has never had flu shots or anything. Does he need to have the flu shot and the swine flu shot before he goes? They have to be at school on the 20th this month.
Well, yeah, so should he get the flu shot? Yes, he should. I've heard that we've heard a little of the flu mist. The nose spray is out in our clinic in a very small amount. We don't have the shot yet, and I think most places don't have it. It's a little early yet, so it wouldn't be required for him to get to college next week. But I think, yes, when he may be able to get it on the college campus in the student health, or weekend he comes home, get it home. But I think definitely, he's going to be in a situation around more crowded condition living in the dorm. And so that many schools require some of the other vaccines, like the meningitis, the meningococcal vaccine, a tetanus, diphtheria, and whooping cough booster.
Right.
And then now the new HPV, human papillomavirus vaccine, is approved not just to prevent cervical cancer in girls, but is approved for males, for boys. And I think that vaccine is not yet required for college, but is really something. I think it's a nice gift that maybe you could give your child going off to college, not necessarily giving them the permission to be sexually active, because we know that HPV is a sexually active disease or sexually transmitted disease, but prevention of genital warts. And then there are HPV cancers that we know will be prevented later on in life, both in males and females. So really important. Yeah, and we talk about meningitis. You and I have seen kids with meningitis.
Right, particularly in such close situations, close living situations, dorms where, and also kids who maybe might not have the best health habits when they start college.
Right.
Sleep is...
Right. So it puts them at risk. They're not immunocompromised in the way we think of something wrong with their immune system, but they are at risk because they're sleep deprived, they're not eating right, they're stressed, and so it does put them at risk.
Yes, it does.
Right. And so if we can prevent just even one case of meningitis, we're very happy we don't see that. So I just saw something this afternoon which really maybe the kids are going back to school, but riding ATVs. I saw a dad with about a 4 or 5 year old kid on his lap riding down the street. So what's your opinion, Maggie, on ATVs in West Virginia?
I know that a lot of families, that riding ATVs is really a very important family activity. And I guess from my point, I've seen some very sad outcomes from riding ATVs. And I think it's very important that if children are on ATVs, one, that they're not driving them without, training, that they have helmets, and that it's done very, very safely.
Right.
I recognize that, for some families, it's a way of life, but it really, every time I see a child that's been injured and severely injured by an ATV, it makes me very sad that it could be prevented.
Right, and you see the ones with head trauma, and then neurologically they may be very impaired. And I see them because inevitably then they're in the ICU and then they get an infection, or may get an infection from their crash, and so I see them too. Yes, it's very sad. And I think that West Virginia actually leads, or is very close to the top of ATV deaths.
I think
nationally.
You're right on that. I think that,
and so that's very sobering.
It really is. I mean, every time you see a child die, it just is. It's just really.
Well, let's talk about our healthy kids and change on that. We have just a little time left. Any last thoughts you have about getting your kids from your clinic back to school?
Well, as we were discussing, just be prepared, fill out your forms on time to have your child with his medications available when they go back to school.
Make sure you have refills.
Refills, yes. Right. The form to carry to have with them the rescue inhaler. Schools will not allow the child to carry his own inhaler, depending on the age in some schools, but mostly the nurses will have it.
Right.
Yes, to have that.
Right. And we have, Monday will be 2 weeks till school, so ratcheting down the bedtime, maybe every night.
Some schools are starting 2 weeks, even 2 weeks from today. Some are starting the 19th. So I think really getting back to those good sleep habits, parents beginning to set aside time for homework every night, that the TV's off, everything's off.
Reading, getting in the habits of reading again.
Getting in the habits, start to review a few things if you haven't done things over the summertime. get kids back to
eating breakfast. I know my kids get up so late that they eat kind of a brunch, but yeah, the good habit of a good breakfast.
Right.
Yeah.
Right. Getting them ready.
Getting ready, and so as people scurry to do their school shopping, and we're excited. Hopefully it'll be a good school year, and get vaccinated so we don't have a big flu year next year. So we've been talking about children's health with Dr. Maggie Janes and Dr. Sylvia Cardenas. Thank you both for being with us. If you'd like more information, talk to your family doctor or visit our website at wvuhealth.com. For Doctors on Call, I'm Dr. Kathy Moffat. Good night and good health.
Join us again next week for another edition of Doctors on Call. Major funding for Doctors on Call is provided by a grant from the Milan Charitable Foundation. Other funding is provided by the Health Plan, a health maintenance organization serving West Virginia and Ohio since 1979. By the Center for Organ Recovery and Education, supporting Volunteers for Life through organ, tissue, and corneal donation. By Health South Rehabilitation Hospital, serving your rehabilitation needs in Morgantown and Fairmont. And by the faculty and staff of the Robert C. Byrd Health Sciences Center of West Virginia University.
This has been a production of West Virginia Public Broadcasting.